Good morning. Welcome to today's Community Connections on Stanislaus County Family Caregiver Support Program. I would like to introduce Tiffany Leighton. She is the planner for Stanislaus County Department of Aging and Veteran Services, and she's an Army veteran herself. And just a reminder, you can enter questions in the chat box, and our video is being recorded and may be found at our Community Hospice YouTube channel. Tiffany, whenever you're ready.
Hi, everyone. I'm really happy to be here representing the Department of Aging and Veteran Services, and specifically talking about one of our programs that we provide as a direct service, and that is the Family Caregiver Support Program. Next slide. Can I control it from here? This is our overall agency. Under the umbrella of the Stanislaus County Aging and Veteran Services is the Area Agency on Aging. That was our address. And we have several federally funded programs through the Older American Act, and they come down through the California Department of Aging. One of those is the Family Caregiver Support Program, which you see highlighted here. The Family Caregiver Support Program, the main mission is to assist the informal or the unpaid caregiver of frail older adults age 60 and over, and also adults over 18 with dementia or Alzheimer's related diseases. And this program is offered regardless of income. And the other primary mission of the Family Caregiver Support Program is to provide in-home occasional assistance to the care receiver in order to give the respite to the caregiver and a break from their responsibilities. So once again, there is no income qualification, and it is to assist the informal or unpaid caregiver. If the caregiver is being paid, that may disqualify them. So this is strictly for caregivers who are unpaid. Next. And you may ask yourself, who is the caregiver? Who might a caregiver be? A caregiver can be anyone, basically. It could be a spouse, a significant other, a family member, or a friend. The key is for this program is the caregiver must be identified when they are calling to apply for services. So in other words, our agency unfortunately does not find caregivers. If someone may call and they need a caregiver, we do need to refer them out. So, but once again, it's a loose definition. It could be a friend who's looking out after the care receiver. The caregiver does not have to live inside the home. The care receiver could be living alone and somebody else is helping them out. But once again, that same caregiver might need a break, or they might need to help the care receiver get further assistance. In addition to that, the caregiver must be designated, well, I already said that, they must be designated prior to receiving services. Those are the basic qualifications or the definitions of a caregiver. The qualifications for our Family Caregiver Support Program are, once again, the care receiver should be 60 or older. The care receiver also could be an adult who's been diagnosed with Alzheimer's or related dementia. And this is the other key one. The care receiver must have at least 2 activities of daily living, which we use the acronym ADLs, with which they need assistance. So for example, we define activities of daily living as bathing, toileting, getting dressed, eating, walking, and transferring in and out of a chair or bed. So for example, if they cannot do 2 of those things, or they need assistance, we rate them when we do the assessment. They need assistance with 2 of those things, and they do qualify. So that's just a determination of determining that they're frail. And the other qualification is that they reside in Stanislaus County. And as far as who provides respite to the caregiver and the care receiver, this would be the Area Agency on Aging, which is us. We contract with 2 home health agencies. Currently, we contract with Addis and we contract with Legacy Home Care. Those are our 2 main providers of respite care. And respite care it can be things like personal care, housekeeping, companionship, and maybe occasional supervision of the care receiver. And the way our hours work is initially when the assessment is done, we're getting ready to renew, for example, right now with the new fiscal year, it starts July 1st, and they can receive up to 40 hours of services from one of these 2 health care agencies. And we do provide the brochures, and they're allowed to choose for themselves. We don't choose for them. And they receive the 40 hours initially. And we do sort of because of our budget, we do a sort of a prorated scheduled service of those 40 hours. So for example, if they register in the first quarter of fiscal year, they'll receive the total 40 hours. If they register in the second quarter, it goes down to 30 to stretch through the rest of the year. The third quarter, it goes down to 20, and then the fourth quarter goes down to 10. Now this year we had some extra money in our budget, extra funding, so we were able to just keep the 20 hours towards the end of the fiscal year and hold that all the way to the end. We didn't go down to 10. So it's sort of a budgetary way to just make sure that the funding lasts for the whole year, because we don't know who's going to be calling and needing assistance. But then the other thing with the 40 hours is that there isn't an expiration date. If they still need the service and they need to renew coming up in this new fiscal year, then they can just they'll keep renewing their 40 hours when the new fiscal year makes the turn. A couple other things about the program is we do provide assistive devices, such as grab bars, shower chairs, raised toilet seats, and things that will help. The main mission is to keep people in their home as long as possible. And these things are not typically covered by insurance, so we will provide those assistive devices on an as needed basis, depending on what the assessment. We do home visits for all of our clients. We have 1 social worker for this program, and we go into the homes and she'll do an assessment. We're doing a lot of referrals currently to this amazing, fairly new program. It's called Dignity at Home, and their primary mission is to go into homes and provide assistive devices for older adults age 60 and above. So even if they aren't part of our program, but they just would like their home evaluated and they're feeling a little unstable, we want to prevent people from falling, keep them in their home as long as possible, they may qualify for this Dignity at Home program. So we work closely, which is really nice. That nonprofit is Healthy Aging Association. They are in our office here on Coffee Road. So it's really nice. We have a great collaborative partnership. We work together to make sure that, like I said, the seniors can stay in their homes as long as possible. The other thing that our program provides access to support groups, training, supplemental services, and of course, referrals through our senior information and assistance line. All of our assessments and referrals to our family caregiver support program come through our senior information line. So there's no other direct phone number. That is the hub that we continue to use for this program as well. There's an 800 number also for senior and caregiver information, which I've listed here. And I also wanted to point out or just show you one of the brochures you can call our line if you would like one mailed to you, or you can stop by our office. But we have these caregiver support guides. And what I was saying is, you know, if people, we can't refer you to or provide a caregiver. So sometimes people are looking for other resources, and this is a guide that we provide. You can also find this on our website if you just want to go on there and look or print. And our website is www.agingservices.info. And you could find other caregiver information and resources on there as well. Next slide. And once again, I'd like to point out our senior information line because that is the hub for all of our senior services here in Stanislaus County. And that's 209-558-8698. It is our main information and referral line. Even if you wanted information about that Dignity at Home program I mentioned, our family caregiver support program, any of our programs, you would call this one main number. And that's where the referrals get made, and they are referred out to the specific programs. And then we follow up in returning the phone calls and doing the assessments. And once again, the 800 number is also listed there as well. Next slide. This is another contact page that has our website, and just pointing out that we are also in with Veteran Services, which we offer. We don't offer the medical, we're not the VA, but we offer any information about if veterans are looking for information on what they might be eligible for, claims to the VA, all that, anything you may need to ask, we can hopefully answer for you here in the Veteran Service Office. We're all one big team here. And that's it for my presentation. I don't know if there's any questions, but that's the next Community Connections virtual web presentation being offered in June.
Can you hear me?
Yeah.
Okay. Thank you so much. We had one question here in our chat box.
So can respite care be provided overnight?
Yes.
No, unfortunately, in this case, sometimes we can work out an emergency situation. So I'm not going to say it's not definitive. There is some flexibility, but typically that's not the typical situation. But that's a great question that leads into me pointing out that this can also be, that our family caregiver support program can also be temporary, meaning that if someone's coming home from the hospital, say in their, a daughter or son lives out of town and they need to call us and say, my mom's coming home from the hospital, she's going to be recovering, but she needs some help. She'll be fine after that. That's when we could go out and do an assessment and provide her, or, some respite care and get the home health agencies in there and involved right away. We've had some situations where we've had to act fast, but that's not the typical situation. But we would do our best if that call came in to try to assist them, of course.
Awesome. Thank you so much for answering. And thank you for presenting today, Ms. Tiffany. If any of you in the audience need additional resources, you can contact Community Hospice at 209-578-6300, or you can visit hospiceheart.org. I'm going to invite you to our next presentation on June 22nd, and that's at 12 p.m., and that's on the stages of grief. And just so you remember, the video is available at our Community Hospice YouTube channel. Thank you all for joining.
Thank you. Have a good day.
Thank you. Have a good day.